Welcome to this webinar. We are coming live from Northern California, and this has been a stressful time, really globally, and it can have a significant effect on our immune systems. And during this global crisis, we thought it would be best to actually come to you via free webinar. First time that we've done something like this, and we hope that it's helpful for you. Overcoming stress during trying times. And I'm really going to center in today on what's called oxidative stress. Oxidative stress is when we have external stresses, or sometimes they're internal stresses, and it actually changes our biochemistry of our cells. When the cells are under stress, they produce reactive oxygen species, which are not just regular O2 or oxygen. These are what we call free radicals. And these free radicals can cause some significant problems with our immune system and significant problems with our entire cellular structure and our ability to function. But as a result of what we have learned from oxidative stress, it's actually possible for us to enhance our immune systems while under stress if the right conditions are there ahead of that stress, or if we make some changes very early on in this stressful situation. And so we can turn the disappointments of unanticipated stress into appointments and actually enhance the immune system. So oxidative stress was first discovered in the research of human aging. And we know that this is very critical in regards to how healthfully we age over time. An imbalance between oxidants and antioxidants when the organism has exposures to adverse stimuli is what produces this oxidative stress situation. And so when we have not enough antioxidants on board and we have this stressful oxidative stress going on, this is what is going to tip the balance in the wrong direction. Oxidative stress has been well recognized in the disease process as well. And the pathophysiology of oxidative stress has now been proven in cardiovascular disease, in diabetes, in cancer, in Alzheimer's diseases, and there's evidence now suggesting that oxidative stress is increased in a number of psychiatric disorders as well. For instance, this study on oxidative stress and depression, there was a multiple logistic regression analysis that actually looked at the hospital admission depression scale. This is a standardized depression scale when people are admitted to the hospital. And it turns out that the sole independent contributor to how high their depression level was is actually a byproduct or something that's produced as a result of oxidative stress. And this oxidative stress is actually called hydroxydeoxyguanosine. And this is something that can be measured. And depressive symptom score was shown to be independently associated with that in middle-aged women who were admitted to the hospital. Both preclinical and clinical studies revealed that depression is associated with altered levels of oxidative stress markers and typically reduced concentrations of several endogenous antioxidant compounds. So when someone has depression, we'll notice they have lower glutathione levels. They have lower vitamin E levels. They have lower zinc levels. They have lower coenzyme Q10 levels. They'll have lower levels of a number of different enzymes, including glutathione peroxidase, and their total antioxidant status is diminished. And this is one of the reasons why we believe antioxidants have such a vital role in even helping people recover from depression as well. Oxidative stress can inactivate actually neuronal receptors. And so when those receptors are inactivated, the neurotransmitters are actually not working. There are enzymes that are deactivated from oxidative stress. And then there are ion channels that just don't work as a result of oxidative stress. And so you can see the amount of complications that can occur. This is kind of a schematic of a normal cell and what happens when those free radicals start to happen and they're not being gobbled up, so to speak, or being reduced by antioxidants. Those free radicals are diagrammed from the red there in the cell, and you can see that as this process continues, it's kind of a vicious feedback cycle, and notice how much that cell looks like it's aged over time, and this can occur actually in a matter of a few minutes, sometimes even a few seconds, as a result of oxidative stress and what it can do to us at the cellular level. Now, of course, there are outside environmental sources that can bring about oxidative stress. Those are just a few of them that are listed there on the left upper side of your screen. But this is, we could put others there, like a high sugar intake. If you are eating a sugary drink like a soda pop, it will increase the amount of free radicals in your blood stream by about 14 times. And so even diet can play a role in this, but of course cigarette smoking, pollution, these things can bring about oxidative stress. And the ROS is the abbreviation for reactive oxygen species. And you can see how this produces inflammation. There's damage to the mitochondria. These are the energy producing cells. There's pro-inflammatory signaling. We'll see actually elevated interleukin and inflammatory marker levels. And then one of the most serious things is it can actually and will actually damage our DNA. This is the actual genetic code inside the nucleus. And when that gets damaged, that's what can start cancer and dysplasia. And this, of course, is one of the major causes of death in our society is cancer. In fact, it's very clear now that more people will die from cancer this year than even COVID-19. Although COVID-19 is getting all the attention, cancer deaths are occurring, will actually have occurred at over 5 times the rate of COVID-related deaths, at least for the year, based on our projections of what will happen throughout the remainder of 2020. And then, of course, there's muscle dysfunction and tissue remodeling that has to occur, and impaired function on a cellular level. You can see these reactive oxygen species and the chain reaction that results. The membrane itself of our cell will get damaged from these reactive oxygen species. And that means things can get in the cell that would normally not, and things that are supposed to be in the cell will start leaking out into the extracellular material. Lipid peroxidation, and of course our cells are made up of lipid membranes, and so this peroxidation is actually a damage of the lipids and an oxidation of these lipids that are occurring. And of course what this does is it actually depletes any antioxidants that are in the cell. The antioxidants are needed at this point, but it's really all those antioxidants are being gobbled up from these reactive oxygen species. And that's when our DNA can break as well. And then we get some pretty bad outcomes such as apoptosis. This is when our cells actually just die or explode, or there's necrosis. There's actually death of tissue, and even death of neurons can occur as a result of oxidative stress. So oxidative stress is something that's been studied particularly the last decade. It was starting to be studied after the year 2000 to a large extent. But now we have enough research to realize that this is implicated in virtually every known human disease. We mentioned cancer, diabetes, virtually every inflammatory disease revolves around oxidative stress. When our immune system is not functioning, this it's going to involve oxidative stress, maybe as a cause of the immune system actually declining. And infectious diseases, of course, involve this as well, because when our cells get infected, to fight them off, there has to be some free radical warfare that occurs. And if we don't have the right conditions for that cell itself can die or become very dysfunctional and can actually propel the infection and make it worse over time. And then there are a number of mental conditions. We mentioned depression and anxiety and its role in oxidative stress. Cognitive decline. When we have too much oxidative stress around and not enough antioxidants, this causes age-related cognitive decline. So it can affect our memory. Parkinson's disease is actually a disease of toxicity where there's oxidative stress resulting from the toxins, and there aren't enough protective aspects of our cell around to protect us from actually destroying the dopamine-producing cells in the brain. Alzheimer's disease is a disease of oxidative stress. And of course, anything that accelerates aging, of course, is going to be related to this as well. So today, in regards to the viral crisis that we see going throughout the world, I thought it would be good to take a look at what we know about oxidative stress during viral infections. We know that this has a crucial role in regards to how influenza reacts to our body, and actually how it can accelerate and cause a cytokine storm and even death. Influenza is well known to kill even young people, as well as middle-aged and elderly people as well. The HIV infection involves oxidative stress. Hepatitis B involves significant inflammation of the liver due to oxidative stress. Hepatitis C as well. And then coronavirus also, we clearly know is actually causing oxidative stress. And if our cells are set up to not be able to handle this well, that's when things can get out of control and we're at much higher risk of going into that cytokine storm. There's a crucial role of antioxidants in decreasing viral replication and in decreasing viral-induced oxidative injury to our cells. And so we want to have those antioxidants around so that the virus doesn't take over our cell and just continue to reproduce itself, which is what viruses do under the right conditions for them, wrong conditions for us. So in studying the oxidative stress, it's good to take a look at some recent studies. This was published in December of 2017. You can see the reference down there in the bottom of the screen. The crucial role in influenza and viral pathogenesis. And the study showed that antioxidants are one of the effective strategies of prophylaxis and treatment of influenza virus infection. And there's a high likelihood that this is also very much the case in regards to COVID-19. The influenza A virus, like COVID-19, is an RNA virus. There are DNA viruses and there are RNA viruses. This is an RNA virus, and it's one of the major causes of respiratory disease pathogens with characteristics of high morbidity and mortality. In fact, the death rate for influenza A this year, at this point in time, is actually very similar to the death rates for COVID throughout this winter season, although we anticipate that COVID-19 or COVID-19 is actually going to supersede this. It was a bad year for the flu as well, and the flu was really a pandemic as well. The flu pandemic has repeatedly erupted around the world, and you may be familiar and have heard a little bit about the 1918 Spanish flu, the 57 Asian flu, the 68 Hong Kong flu, and also the swine flu of H1N1 in Mexico that broke out in 2009. In 1918, the influenza pandemic, which was really the swine flu, and it started in Spain, caused 500 to 700,000 deaths in the United States. And thank God it looks like COVID-19 isn't going to get close to that at all. Almost 200,000 of those deaths occurred in 1 month alone, and that was in October of 1918. It caused 30 to 40 million deaths worldwide, mostly actually in the age group of 15 to 35. And so in reality, this was something that was even more serious in the immune system because it was killing people that were thought to have otherwise healthy immune systems. In 1957, the H2N2 influenza pandemic caused an estimated 70,000 deaths in the United States and 1 to 2 million fatalities worldwide. And COVID-2019 might be getting close. There are some estimates that there'll be 60,000 deaths, some 80,000 or so, and they're thinking we might be able to avoid what they were thinking of earlier, that might be 200,000, and some projections were even 2 million. Obviously, not going to happen, at least this year, the way things are settling down. And as long as we continue the immune system enhancing things as well as the precautions in getting the virus. In 1968, the Hong Kong flu, which was the H3N2 influenza epidemic, caused 34,000 deaths in the United States and 700,000 to 1 million fatalities worldwide. And the 2009 H1N1 influenza swept more than 214 countries, resulting in the highest level 6 of the World Health Organization's flu pandemic alert and resulting in at least 18,000 deaths. And as we study the flu, it's very clear that reactive oxygen species are involved. They will exceed the removal of the oxide. The balance between the oxidation system and the antioxidant system will be broken, resulting in an aggravation of a certain type of white blood cells called neutrophils, inflammatory infiltrates, the rising of protease secretions, and the accumulation of oxidation intermediates, ultimately causing tissue damage, a marked inflammatory response, and cell death. And emerging evidence has demonstrated that oxidative stress is an important contributor in a lot of other viral infections, including the herpes virus infection, the Epstein-Barr viral infections, influenza, and SARS as well. Now, I was speaking, as our title was, it's on neuroimmunology, and of course, our mental health has a significant role in regards to how our immune system is actually functioning. And the human brain is actually highly vulnerable to oxidative stress due to its high oxygen consumption, its modest antioxidant defenses, and its lipid-rich constitution. The human brain utilizes 20% of oxygen consumed by the body, even though it only weighs 2% of the entire body mass. And so when you have this much oxygen being consumed, you're of course at more risk of reactive oxygen species developing, and particularly with all of those lipids around as well. When the production of oxygen-derived metabolites prevails over the brain defense mechanisms, oxidative damage will occur to nucleic acids. These are things like DNA and RNA, proteins, neuronal membrane lipids will also be damaged, which are high in polyunsaturated fatty acids, and that makes them more vulnerable to damage as well. Now, anxiety, we know, plays a significant role in actually depleting our brain system of the resources necessary to help our immune system. An adverse emotional state is what anxiety is, in which the feeling of fear is actually disproportionate to the nature of the threat. Now, it's normal to feel anxiety and to have some anxiety when there are threats. But when the emotional fear is actually disproportionate to the nature of the threat, that's when there's actually a disease state called anxiety. And this involves behavioral, expressive, and psychological features. Some of those things, like the behavioral ones, would be avoidance of the source of the danger. And by the way, speaking of that, we have a society that is very anxious today. A lot of governments thought when they mandated or recommended social distancing, and they recommended these travel bans and these sorts of things, that they anticipated that maybe half of Americans would be very careful in regards to this. It turns out over 90% of Americans have been very compliant with all of these recommendations. One of the reasons is Americans have figured out how COVID-19 actually causes death. And literally, as far as a lay term, it's death by suffocation. It's one of the worst ways of actually dying, is where you're starving for air, you're short of breath, and you can't get it. And of course, this is the acute respiratory distress syndrome that occurs as a result of what's happening to the immune system in these later stages of the disease. And because people are so fearful of dying in such a way, they have had a very high compliance rate as far as trying to avoid the virus completely. And so they needed some anxiety to be able to have that compliance. But in addition, however, the anxiety is associated with assuming defensive postures. That would be the expressive phase. You can even tell on someone's face. Even when they're shopping at a local grocery store, the anxiety in their eyes when they're out in public today. And of course, blood pressure is adversely affected. When anxiety goes up, blood pressure also tends to go up. And that's one of the things that actually is one of the comorbidities that can make the coronavirus infection even worse and increase the risk of death. Not too long ago, a medical student's immunity was measured, and we found out that every year when they underwent their 3-day exam period, their immunity went down significantly as a result of this stress and anxiety. Test takers had fewer natural killer cells, which actually fight tumors and viral infections. So they're particularly prone at that time, if they have some DNA damage, to not recognize it and to not recognize the virus as an intruder and to let it get out of control. They almost stopped producing immunity-boosting gamma interferon completely, and infection-fighting T cells responded only weakly to stimulation, where if they weren't under this anxiety, they would respond a lot higher. Stress of any significant duration, particularly from a few days, like the test takers, where it was just 3 days, to a few months or years, essentially affects all aspects of immunity. And that is, just about every aspect that we measure goes down and immunity plummets. Thus, long-term or chronic stress through too much wear and tear and not enough coping resources can ravage the immune system. Those with chronic mild depression had weaker lymphocyte T cell responses to 2 mitogens, which model how the body responds to viruses and bacteria. The immune response was down even 18 months later, and immunity also declined with age. We know age does have a detrimental effect on immunity. It's been very obvious in the COVID-19 crisis that elderly people's immunity is much more likely to succumb. But an additional factor that will suppress immunity is actually even mild depression if it's chronic, if it lasts a long time. In fact, a 2004 meta-analysis showed that the key immune factor was how long the depression lasted, not actually how severe it was. And so if you take a severe short bout of depression, that actually was better as far as immune system function than a mild, prolonged form of depression. This is one of the reasons why we recommend that you don't put up with depression and anxiety. A lot of people put up with this for years when it's mild or moderate. Maybe only when it's severe or when there's a suicide attempt do they actually are kind of forced in to doing something about it. But it's actually far better to not put up with these diseases like depression and anxiety as if they're normal, because we think they're not adversely affecting us. They actually are adversely affecting us. And we need to really find out the cause and be able to reverse that. And that will help our immune system significantly. And as you see at that last sentence there from this study, in case of the older caregivers, their depression and age meant a double whammy for immunity. And this is something that hasn't been looked at yet in COVID-19. It's happened so quickly. There hasn't been research protocols in place. But I can almost guarantee you that we would find that those that succumbed to death were actually much more likely to have a chronic depression on top of their elderly age that made it far worse for them to be able to fight this virus. So there are conditions, of course, that are exacerbated by stress beyond just viral infections. Arthritis has been shown to be exacerbated by stress. Fibromyalgia is very much exacerbated by stress. The muscle and fibrous and tendon pain associated with fibromyalgia. Autoimmune diseases like lupus are very much exacerbated by stress. We can actually point to lupus flares as a result of oxidative stress or external stressors that the person couldn't seem to handle that well. Psoriasis also is exacerbated by stress. Inflammatory bowel disease, which is something I'm very familiar with in my field of gastroenterology. Ulcerative colitis, Crohn's disease. These things are very much exacerbated when we have immune system compromise of some sort. And in fact, our immune system can actually be overactive in the wrong ways and underactive sometimes in the right ways. Shingles, herpes virus, when we get a herpes virus, it actually is when our immune system is able to fight it off, it actually finds safe harbor in our nervous system. And this can even occur right there at the spinal root nerves. And then it will wait around for when the immune system is compromised. And when it's compromised, it will actually come out as chickenpox. That's a certain type of herpes called herpes zoster. And it will affect the skin of the entire nerve root that came from that spinal cord. And we will always see stress being associated with that. And so it's very clear that stress has a significant role in immune compromise in bringing about the recurrent shingles that can occur. Or even shingles one time will be due to stress. And our immune system can actually be helped a little bit because we've had to fight off those multiple herpes zoster viruses, but it'll hide out again and it'll wait for when the immune system's compromised again, and it can come out, and it's very painful. It can even produce chronic pain. Anxiety, of course, is exacerbated by stress, as is depression. And these things can also elevate cortisol from our adrenal glands. And cortisol can have some additional immune suppressing effects. And it can produce even some body metabolic changes that aren't good, such as thinning of the bones, osteoporosis, and even the formation of central obesity can be a result of this excess cortisol. Anxiety disorders before COVID-19 came out affected 28.8% of the US population. And by the way, a lot of people aren't aware of how this virus was named. The CO is the corona, the VI is the virus, and the D is the disease. So it stands for coronavirus disease. And it was named 2019, shortened to 19, because that's when the virus was first described at the end of 2019 in Wuhan, China. Obviously, when we had 28.8% of the population being affected by anxiety disorders in the United States before this occurred, you can imagine what it is now. There haven't been some good studies done on it yet, but I can tell you the anxiety rates have significantly increased since then. And so not only do we have a fear of the virus and everyone's trying to avoid it, which actually may be an exercise in futility, we might be able to avoid it short term, by staying inside, but we can't actually stay isolated our entire life. And this virus is going to be out there, and some experts believe 40 to 70% of the population are eventually going to get this. And so that's why it's very important for us to control our anxiety, to get on mental health enhancing measures to help our immune system. So if we do come across it, it can fight it off. And also some physical features of enhancing our immune system, which we'll talk about, which really actually helps us counteract the oxidative stress as well. Oxidative stress parameters can be normalized by antioxidants. Zinc is one of those things that we'll talk about that actually acts as an antioxidant and helps us. N-acetylcysteine is a very potent antioxidant, a naturally occurring antioxidant that our body makes. And we can also get it in supplemental form, or we could get the cysteine itself in food that we'll talk about, or omega-3 fatty acids. These are anti-inflammatory fatty acids that we tend to have a lot less of than the omega-6, which are pro-inflammatory. And these oxidative stress parameters can actually be normalized by things such as what we just mentioned. And it can help explain their antidepressant properties, or why they may enhance standard antidepressant therapy. And there have been so many studies showing the benefits of mental health on those agents as well. Zinc, N-acetylcysteine, omega-3, all have been shown to have significant benefit in mental illnesses. And of course, there's a lot of other antioxidants that can also have a benefit as well. So a few years ago, the Human Nutrition Laboratory in Baltimore, Maryland, actually described the top 10 antioxidant vegetables. And what we do know is that vegetables and fruits, the antioxidants they have, actually exceed that of their component parts. For instance, a cup of kale can have about 30 milligrams of vitamin C, but the antioxidant potential of a cup of kale is actually equal to 1,100, well, it's actually 800 milligrams of vitamin C and 1,100 units of vitamin E. Those are two very antioxidant vitamins, but you'll do better actually with the kale than taking that much of those vitamins. And so we need to look at whole foods maybe as nice antioxidant medicine. Hippocrates said, let your food be your medicine. And certainly the top 10 antioxidant vegetables can function as medicine when we are stressed. Eggplant is number 10. Number 9 is corn. Number 8, onion. 7, red bell pepper. 6 are beets. There's so many studies showing the potent antioxidant effect of beets. Number 5 is broccoli. Number 4, Brussels sprouts. And if you don't like Brussels sprouts, you've got to come to Weimar and eat our Brussels sprouts. I think you'll like them here. Spinach is number 3. Number 2, a very potent green, is kale. And the number 1 antioxidant vegetable is garlic. And garlic actually has some antiviral and antibacterial properties as well, but it will also help our cells be able to fight this off because of its very high antioxidant potential. The top 10 antioxidant fruits by the Human Nutrition Laboratory were as follows. Number 10 was grapefruit. Number 9, kiwi. 8, cherries. 7, red grapes. 6, oranges. Plums. Plums are a humble fruit, but yet they are loaded with antioxidants, even higher than the fruits that are mentioned below plums. And the top 4 actually all have one characteristic in common. They're part of the berry family. Number 4, raspberries. Number 3, strawberries. Number 2, blackberries. And number 1, blueberries. Now, I'd also like to mention, in regards to brain health, the importance of a couple of carotenoids. Carotenoids are known in the vitamin A family. And there are 2 in particular that have been shown to be very healthy for the brain. Lutein and zeaxanthin. Now, you might be familiar with those names because we know they help so much with eye health, and they can actually prevent cataract formation. They can prevent macular degeneration. And so they were first discovered in regards to how healthy they were for our retina and our eyes. But recently there have been studies showing how healthy they are for our brain. This was a study of 100-year-olds in Georgia, and anyone who makes it to 100, one of the big questions is, how well is their brain functioning? Because over half of people that make it to 100 are going to have severe dementia if they're fortunate enough to live that long. But not everybody. Some people at age 100, their brains are very sharp still. And so they looked at all of those that had made it over 100 in Georgia, and they looked at their antioxidant vitamins and found that only lutein was related to better cognition in the 100-year-olds. Vitamin A was not related, beta carotene was not related, vitamin E was not related, another form of vitamin E called alpha tocopherol. So no difference. But where they did see a good statistically significant difference was in lutein. They also measured lutein in the retina in another study, and they correlated that with the cognitive test scores, and they found out the more lutein in your retina, the higher your mental ability and the better you are able to do on tests. It turns out lutein improves neurotransmitter efficiency and also white matter integrity. Lutein content in the macula is associated with improved cognitive function in adults and in children, and is modifiable, fortunately, through diet. So often we want to avoid losing our vision when we age, and one of the primary causes of loss of vision, particularly now that cataracts used to be even more common, but now, of course, we can do cataract surgery and put in a new lens, and that's something that's reversible, but macular degeneration is not reversible. Once that macula starts to decline, it's really part of our nervous system, and nervous tissue can't really regenerate itself, and so the best we can do is try to preserve what's left. But we're now finding out people that lose their vision from macular degeneration, which is a top leading cause of blindness in the United States, and this is the area where our fine-tuned colors are, our high definition is when we're looking straight ahead, that when they start losing that, they're also going to start losing their cognitive ability. So let's take a look at the foods that are medium to high in lutein and zeaxanthin. Romaine lettuce is up there. 1 cup will have over 2,300 micrograms. Peas will be higher yet, 2,500 per cup. A tablespoon of coriander, 5,500. A cup of parsley is going to have quite a bit. Just 2 tablespoons of fresh basil, 5,600. Watercress, 5,767. Sweet red bell peppers, 5,798. And then there are a couple of greens, lamb's quarters. This is not the hind leg of a small sheep. It's actually a nice tender green that's high in calcium. 6,000 micrograms of lutein and zeaxanthin. And radicchio, raw, 8,800. And mustard greens are up there at the top of this medium list, almost 10,000 micrograms. And then the ones that are all higher than 10,000 are chicory greens, collards, Swiss chard, garden cress, turnip greens, paprika, dandelion greens, which are up there over 13,000, spinach over 15,000, and notice kale, 39,000 micrograms per cup. And so kale is one of those great foods that can actually preserve our macula and also preserve our brain function as we age and keep us cognitively sharp. And it will actually increase our likelihood of living to 100 and even much more, staying sharp when we are 100. Another important antioxidant is cysteine. Now, as you can see here, one of the supplements that I recommend if we're trying to avoid the flu or viral infections, and it can even help out in regards to inflammatory depression and it can help out in obsessive compulsive disorder, trichotillomania. There's even been studies showing how it can help certain forms of schizophrenia. Is the supplement N-acetylcysteine, which you see there in the box up in the left. And N-acetylcysteine gets readily absorbed into the body. It passes the GI tract very readily. And a process called deacetylation also takes place rather readily, and that actually makes cysteine. Now, cysteine, there's two forms of cysteine. There's cysteine called EINE, which is an amino acid, and there's cysteine that's primarily in food called cysteine without that middle E. It would be CYSTINE. And cysteine is actually when cysteine with EINE is oxidized, it actually turns into cysteine, and it's a little harder. Cysteine has to add a hydrogen group in the food to get over to cysteine itself. And as a result, cysteine tends to be pretty low in the human body because of that difficulty in being able to translate the cysteine in food over to cysteine EINE. Now, there are two other amino acids that combine with cysteine to produce this very powerful antioxidant. Glutamate is the first one, and glutamate is much more readily available than cysteine is. Glutamate, 30 or 40% of the amino acids in wheat, for instance, are glutamine, which turns into glutamate. And then glycine is also readily available in high amounts in the body in general. So normally the substrate that's missing for making glutathione is cysteine. So when cysteine can come into the equation, then it's very clear that glutathione levels will rise significantly. And this is an extremely potent antioxidant that is available on the cellular level that can help us if we have an invader come in, such as influenza A. And it can also help us if we have problems with oxidative stress for other causes as well. It might be even getting toxins into our system, such as acetaminophen. It will protect our livers when we have glutathione up there. And this is how thousands of deaths are spared every year for people that try to do themselves in with suicidal doses of acetaminophen. They get to the hospital and we give them huge doses of N-acetylcysteine, about 17 grams every few hours. And they'll be given that for days, but it will completely protect the liver and not really produce any side effects at all during that time, because this is a natural agent. It doesn't really have adverse effects per se. Now, we can get our cysteine levels up, the EINE levels up, by eating foods that are high in L-cysteine itself. And legumes are one of those sources of L-cysteine that are important. L-cysteine is one of those amino acids that has the sulfur group on it. And if you ever smell N-acetylcysteine, in fact, although I recommend this as a general supplement when you're having stress, if you happen to actually open up the capsule, or it also comes in tablets, you'll notice that sulfur-containing smell. It almost smells a little bit like eggs or more rotten eggs, although it's really the sulfur smell of that cysteine amino acid that's producing that type of smell. But you can see red kidney beans have 182 milligrams, navy beans a little more, 186, large white beans a little more at 190, chickpeas or garbanzos 191, lentils are over the 200 mark at 234 per cup, split peas even higher yet at 249, lupin beans 319, and the highest source, the only legume that's over 400 milligrams per cup, is actually edamame or green soybeans. And fortunately, green soybeans are also high in omega-3 fatty acids, so they'll benefit us in several ways. Now, grains are also fairly high in L-cysteine, and they can also be high in methionine. Under certain stressful situations, methionine can actually turn into cysteine in the system. but it's better to get cysteine itself instead of having to utilize methionine for this. And cysteine is one of those things that also helps us with methylation. So it's going to help our serotonin activity to be better and our dopamine activity to be better. But taking a look at the top 10 grains, couscous is number 10 at 168, teff 174, yellow cornmeal 178, Japanese somen 199. Over the 200 milligram mark is whole grain sorghum flour, kamut, an important grain, 206 milligrams, oatmeal even higher yet at 227, and notice buckwheat. Buckwheat makes it not only over 300 but close to the 400 mark at 389, but oat bran itself is going to be more concentrated at 541 milligrams. And actually uncooked oats that you'll get in muesli that I tend to eat. Erica likes to cook muesli or to have the muesli prepared ahead of time, actually for Saturday morning. It's kind of a standard breakfast. Very high in cysteine, very high in that antioxidant potential at 636 milligrams. And we'll talk about another advantage of oatmeal coming up. Nuts and seeds are going to be your next best source for cysteine. And if we take a look at 3 ounces of seeds, we'll get pumpkin seeds at 282, flaxseed higher, 291, sesame seed butter is over 300, cashews 336, chia seeds 348, sunflower seeds 378, black walnuts 393, and over 400 are actually butternuts. You don't hear of them very commonly, but they're very high in L-cysteine, and above 500 you have to reach for hemp seeds to get that cysteine level above 500. Physical exercise actually you would think reduces oxidative stress, but that is not true. This is one of those interesting things. It's not just that we're totally trying to only give you things that will reduce oxidative stress, because some of the things that help us are actually going to increase oxidative stress levels. As we exercise, there's metabolism going on, there's oxygen consumption going on, and if we're exercising vigorously, we are actually producing some of those oxidative stress molecules. And studies show physical exercise does produce more free radicals. 5 minutes of vigorous exercise will damage DNA if we don't have antioxidants around. This is why it's not just exercise, it's actually diet plus exercise that is the best for us. Marathon runners have been shown to have significant DNA damage because they are exercising so vigorously that they're overwhelming their antioxidant system. We actually weren't designed to run 26 miles in a day. And particularly we'll see that damage go when it gets over 8 miles of running per day. Yeah, interestingly, eating a serving of watercress decreased that DNA damage by over 70%. And that was even in marathon runners. And so watercress, an important antioxidant green, is something that can actually help us to not have that damage. Now, exercise is important because it's going to improve our mitochondrial ability. It'll even improve the number of mitochondria. It's important for energy, particularly as we age. So we don't want to, be a non-exerciser so we don't have oxidative stress. We just want to have the antioxidants around and then get the advantages of both worlds. Something else that helps oxidative stress is actually fasting. Particularly in the evening. Studies have shown if you don't eat anything after 3 p.m. and just drink water for maybe a 17-hour fast, 17-hour fast, insulin resistance will improve, and your blood pressure will go down by 10 points systolic and diastolic. That's as good as you'll get with a potent blood pressure medicine. And it's not just because of weight reduction. Studies have shown if you maintain your weight, in other words, you're eating the same amount of food, you're just doing time-restricted feeding, you're eating at breakfast and lunch, and you don't lose weight by being off of that evening meal because you're eating so much in the time that you're able to eat, you'll still lower your blood pressure even without weight loss by not eating in the evening. And it's been shown to also improve oxidative stress. Then there are some interesting studies in regards to blueberries. This was a study of just 22.5 grams of freeze-dried blueberries, and they were used twice a day in a randomized controlled setting. And so they used a placebo type of Kool-Aid smoothie to simulate that taste of the blueberries, but it didn't actually have blueberries in it. We found a marked decrease in oxidative stress markers from the blood monocytes, less inflammation, and in fact the inflammation was less than half of those receiving the placebo drink, so it was really helping. Another study showed blueberry smoothies of 200 grams pre and post-exercise helped with muscle recovery and less oxidative stress. So it doesn't have to be watercress. It could be blueberries that could help us out. And this isn't the freeze-dried. These are just 200 grams of blueberries put in a nice smoothie. Another interesting study on strawberries. This, I should mention, in my field of gastroenterology, one of the important fields is esophageal cancer. This comes about most often due to Barrett's esophagus, which is due to chronic reflux. And we haven't found anything. Even the PPI inhibitors that a lot of gastroenterologists put these patients on to avoid the acid reflux actually does not help them to not progress to dysplasia or cancer. But there was something that actually did help, and it was actually strawberry consumption. It actually improved the esophageal dysphagia. Strawberries also improve IL-6 production, which is a sign of improved inflammation, and that study was just using 5 strawberries a day. Then there was a recent study using a lot more strawberries in regards to confirmed knee osteoarthritis on x-ray. And they were consuming 1.5 pints per day of strawberries, but their pain improved significantly, inflammation improved significantly, inflammatory markers were down, and quality of life went up significantly. So instead of taking the NSAIDs, which can damage kidneys, you might just try this food being your medicine if you have significant knee osteoarthritis. Then in regards to infections, there's a syrup that has been done in a couple of small randomized controlled trials called elderberry. Now the University of Maryland Nutrition Lab did not actually look at elderberries, so we're not sure how they compare with blueberries or blackberries or the other berries. But when flu symptoms began, if they used elderberry syrup, just a tablespoon 4 times a day, within 24 hours, they had to start this within 24 hours, their flu symptoms actually did not last significantly over 3 days. The brunt of their flu was over with in just 3 days. 93% of them improved within 2 days of starting this elderberry syrup. And there was a placebo group, so we had a control group, and that placebo group did not start to improve until after day 6. So they were sick for a whole week. And then 92% of them did not improve. There were 8% that did improve before day 6, but 92% of them had to wait at least 6 days before they improved if they were just on the placebo. Then I also want to speak about zinc. Zinc is an important cofactor in enzymes. It's involved in the proper functioning of the antioxidant defense system, and it also reduces inflammation. Zinc protects cells against oxidative damage, acts in the stabilization of membranes in part by suppressing copper. Too much copper is a pro-oxidant, and zinc will counteract the effects of copper. Zinc induces the synthesis of metallothioneins, which are proteins effective in reducing hydroxyl radicals and sequestering the reactive oxygen species produced in stressful situations. This is why we measure zinc levels in everyone coming to our program. We also measure copper levels. We like to see zinc levels greater than copper levels. Multiple studies provide strong evidence for the role of zinc in the protection against oxidative stress in several diseases, and particularly in regards to mental health related diseases and anxiety and depression. Another benefit of zinc is it actually shuts down the replication of multiple viruses. When zinc gets into the cell, it will actually stop replicase, and the virus, of course, takes over the copying system of the cell, and zinc will actually shut that down so the virus will no longer be reproduced. And so this is very important in us fighting a viral infection, is having zinc on board. In fact, hydroxychloroquine, which Donald Trump has talked about as being helpful in coronavirus infections, one of the primary mechanisms of actions appears to be that hydroxychloroquine allows zinc to get into the cell much more readily. And so it opens up those ion channels for zinc to get in. And zinc has been shown to be helpful in influenza, respiratory syncytial virus, the rhinovirus, which is another common cold virus, as well as the common cold coronavirus. And there's no reason to believe that it would not help in regards to us fighting the SARS-2 or COVID-19. So we can get our zinc from food. Legumes are one of the high sources of zinc. Black-eyed peas will have 2.2 milligrams, lupin beans 2.3, large white beans 2.5, tied with chickpeas and lentils also at 2.5. But then we get to kotjung beans, which will have over 3 milligrams per cup, tofu 4 milligrams per cup, adzuka beans even higher than tofu at 4.1, and the highest are actually good old-fashioned baked beans, 5.8 milligrams per cup of zinc. Seeds and nuts are also good sources. Brazil nuts and almonds will have 3 milligrams per 3 ounces. Chia seeds and flaxseed also at 3, as well as pecans. Sunflower seeds will give you 6 milligrams, as well as cashews and pine nuts. Pumpkin seeds also 6 milligrams. And the highest source here is hemp seeds, coming in at 9 milligrams of zinc per 3 ounces. And then finally, I would like to mention this important antioxidant that's also an anti-inflammatory called melatonin. As you can see, this article was just published in Life Sciences, March 23 of this year, and it was looking at COVID-19 particularly, and melatonin is a potent potential adjuvant treatment if you come down with COVID-19, either pre or during the infection. Melatonin is also an N-acetyl chemical. We talked about N-acetylcysteine. This is N-acetyl 5-tryptamine. And melatonin has been shown to be a potent anti-inflammatory as well as a potent antioxidant. In fact, we know vitamin E is the most potent antioxidant, that it's a vitamin in our system, but melatonin is actually 30 times more potent than vitamin E. So it's a very potent antioxidant. It also can modulate the immune system. Studies have shown it can prevent this cytokine storm. 6 milligrams daily in studies have shown that it actually prevents this storm of interleukin-6 and tumor necrosis factor, C-reactive protein, other interleukins 1B and the lipoperoxidases. And this 6 milligrams is something that we can produce from a very good system as far as a sound sleep is concerned, or we could also take it as a supplement during this time. It's also been shown to help keep the integrity of the vascular endothelium. So how can we increase melatonin? Early to bed, early to rise will do it. Studies will show we can actually double our output of melatonin production in the brain by going to bed early, particularly before 9 p.m. Having a regular bedtime, a regular circadian rhythm will also help the melatonin production. And if we're outdoors in sunlight, we'll actually make more serotonin, and serotonin in the daytime that we make can turn into melatonin at night. And so outdoor sunlight in the daytime, which will increase serotonin production through the mechanism through the eyes, and getting vitamin D from direct sunlight will be helpful in us being able to make more melatonin at night. Sleeping in darkness or near darkness, where it's just maybe moonlight, not having the lights on or the TV or the internet on at night. And that dark environment is important for us to make melatonin. I can't emphasize that enough. There have been a number of studies showing a lot of disease states when we sleep with the lights on. And we don't get that benefit of melatonin, plus other benefits as well. We'll age much quicker as well when the lights are on when we're sleeping. Eating foods high in calcium and B6 have been shown to increase melatonin production. And it also protects us against free radical damage. So what does that help us with? With oxidative stress, our primary topic today. It can protect us against carcinogens, herbicides, even radiation, and prevent and help fight tumors and delay some of the effects of aging. It also has been shown to assist in coping with stress. It increases the ability to experience pleasure. It lowers cholesterol, blood pressure, and risk of heart rhythm problems, and also lowers the risk of osteoporosis. The yellow there tells us what happens when we don't turn on lights in the evening and we go to bed early. We'll get that nice melatonin peak that'll occur at about 2 o'clock in the morning, and it will stay up there very nice until the morning light hits or we turn on our lights in the morning. And if we go to bed at midnight, we'll decrease that area under the curve by almost half. In fact, one author mentioned a while ago that sleep is worth far more before than after midnight. 2 hours good sleep before 12 o'clock worth more than 4 hours after 12 o'clock. And this could very well be due to this melatonin production that occurs much more easier when we're early to bed, early to rise. Habitual sleepers. So how do we make melatonin? We have to get tryptophan first. Tryptophan turns into serotonin and then melatonin. And when I was in medical school, I was told that tryptophan was found in whole milk, and it's not a bad source, 46 milligrams per 100 grams. But there are higher sources: black-eyed peas, black walnuts, almonds, sesame seeds, gluten, or wheat meat. If we're not sensitive to gluten, this is a good source of tryptophan. Whole wheat bread, pumpkin seeds even higher yet, and the highest concentrated source is actually good old-fashioned tofu. Tryptophan is converted to serotonin. This reaction is light dependent. This is a study showing that when we're outdoors in nice sunlight at night, we'll make this nice melatonin after 6 p.m. Notice that natural melatonin peak, that red line. And if we're just indoors all day, which a lot of people, unfortunately, during COVID-19, they're primarily indoors. They think even getting outside in fresh air might increase their risk of aerosol contamination of getting COVID-19. That is not true. That COVID-19 is not going to be in fresh air. It's not going to be where sunlight is at, particularly when there aren't people around. And so get outside, get that fresh air, get the exercise. Allow that vitamin D in, and you'll actually produce more melatonin. And if you happen to be in that 40 to 70% that's going to eventually come across COVID-19, you'll be in far better shape. And then at nighttime, we need calcium, magnesium, B6, and sufficient vitamin D to make melatonin. And I wanted to mention the high calcium foods. Oatmeal is great in some ways, not great in calcium, very low in calcium. Lentils, not that great either. But quinoa is better, rutabaga is better, dandelion greens, 147 per cup, mustard greens, 152. Baked beans are actually a good source of calcium as well. Just 2 tablespoons of sesame seeds, 176. A tablespoon of blackstrap molasses and a cup of kale will be up there in the 170 range, almost 180 for kale. Turnip greens, 249. Filberts, 254. Green soybeans, not only very high in cysteine, but also high in calcium. 1 cup, 261 milligrams. 10 figs are going to be loaded, 269. Cup of milk, 290. Amaranth grain, 298. Skim milk even more at 301. But collard greens are up there at the top, 357. Carob also at the top at 358. And the highest source of calcium in plants is from lamb's quarters. 1 cup, 464 milligrams. I recommend, just like the US government recommends, that you get 800 to 1,000 milligrams of calcium a day. This can help you make more melatonin, can also help relax the blood vessels, and can help you methylate more. That means if you have cysteine on board, it can help you with better serotonin activity, and it can help you also with better dopamine activity. And then there are foods themselves that are high in melatonin. That's why it's a dietary supplement. And we can, I'm sorry those foods didn't come out that well, but those are bananas at 378, tomatoes are going to be there in the 500 range, corn is up there near the top, 1366, and the highest source is actually oats, 1796, I believe, of micrograms of melatonin. And so this is very important for us to also get the melatonin antioxidant in foods themselves. So I hope this section has been helpful for you. Before we go to questions, I'd like to also mention to you a little bit about what Nedley Health has been up to. As you know, with depression and anxiety being high for a number of reasons, social distancing is also worsening it. We are creatures of social, we are social creatures. And even before sin came into the world, God was stated to have said it is not good for man to be alone. And so we want to be connected, socially connected. This is threatening individuals. I saw a study the other day that teens are very adversely being affected mental health-wise by this COVID-19 crisis and what's happening as they're being isolated at home and this social distancing part of things. But we do have a home-based version that we've had for a long time in depression and anxiety recovery. We also have our community-based program that are run locally by many trained facilitators. I'm sure some that are on this line, trained directors and facilitators. But just now, we are introducing depression and anxiety recovery online. Some people are not able to access the community and local program, but the online program is something that is going to be an inexpensive way for them to be able to have a nice way of being able to access what was only available previously in the home-based and community-based programs, and to have that proper encouragement to follow through. We still have the residential program, even under COVID-19, and I should mention this as well. You know, we're talking this weekend coming up, there may be 2,000 deaths per day of COVID-19. And this is, of course, astronomical and too high. But a lot of people are not aware of, before COVID-19, we were having 7,500 deaths a day in this country. And we're still having those 7,500, plus the addition of COVID-19. What are those 7,500 deaths due to? These are due to chronic diseases of oxidative stress, cancer, heart disease, diabetes, Alzheimer's. Depression and anxiety themselves can bring about premature death. And so Weimar and Nedley Health Solutions have not stopped our programs. We're actually having a residential program next week. And it's actually one of the safest times to travel, and you're allowed to travel for medical and health-related reasons. Fortunately, we don't have a single positive case of COVID-19 in Weimar. And the government also stated there's not a single case in Colfax, the closest larger town from here. And so, and of course, we have protection at the gate. We don't want you to come sick if you have COVID-19, and don't do that. But if you don't have it, this is a great place to come. And even American Airlines mentioned that they're doing social distancing, so you can still be safe while you're traveling. So I would encourage, if anyone is in need of a residential program next week, would be great. But we're also going to be unveiling soon an online program that also has health coaching and accountability with it, the options even for blood work, for physician visits, for counselor visits, two forms of counselors, one for purpose and life counseling, another in regards to correcting the distorted thoughts, what we call cognitive behavioral therapy, psychotherapy by exceptional therapists. And this can be available from the setting of your home. You'll need to go through the residential program kind of in your home setting where you're tuned into the lectures. All the lectures from the residential program will be utilized. Before, nobody could access those unless you actually came to a program. And now we will have that being unveiled soon so that those that are unable to travel, for instance, if you're from Australia and you can't get here, or New Zealand, we have a lot of foreigners come to our program, that they can actually do this program from home if they were wanting to, and try to take advantage of those lectures as well as potentially individual counseling. So stay tuned, and you'll want to see what we're putting out in regards to that additional option so that we can capture some that are, for whatever reason, not able to travel. And so we're going to be right back for some questions and answers. I want you to write down your questions. I think that will occur in the chat box. And then we will be back to answer your questions right after this. Welcome back. We do have some questions from our live stream audience. And again, thank you for joining us here this evening. Number one is regarding antioxidant whole foods. How are they best eaten, prepared? Should they be raw? Should they be steamed? Should they be baked? Well, it depends on the actual whole food. For instance, carrots will actually have a little more of the antioxidant potential by cooking than by raw. The same is true for most grains. Will actually have more availability, and the same can be true for actual legumes as well. Those are best and highest antioxidant potential after cooking. The raw will actually be better as far as fruits. So those are antioxidant fruits. You'll have better antioxidant potential in the raw form, more vitamin C, for instance. Half of the vitamin C is destroyed by cooking. And some of the vegetables also will be actually higher in the raw form depending on the type of vegetable. We didn't mention potatoes, but potatoes are going to be far more antioxidant in a cooked form than a raw form. So it depends on the actual form of the food that we're eating as to whether it's best prepared raw, steamed, or baked. Some of the vegetables, for instance, are actually better steamed than they are actually cooked. The second question, what is the best way to eat watercress and kale? Of course, having the right recipe. I would recommend you get my wife's kale recipe. I haven't run into a person that doesn't like kale the way Erica makes it. It's a very simple recipe, and it's actually steamed, and it has some onion with it as well, some lemon, very well done. Watercress also can be done well steamed, or it can be done raw as well, and there are some great recipes for those as well. Is hemp safe to eat, free from mental side effects? Yes, and hemp is a food that has a very small amount of CBD. It doesn't readily get absorbed. Of course, when the certain hemp seeds are planted, they can actually turn into a leaf that can be actually toxic with THCs, and a lot of people enjoy that toxic effect of the hallucinogenic type of effect that can occur in the mind-altering effect. This is when it becomes dangerous. Marijuana-induced psychosis is well described. It's starting to occur in exponential ways as people are thinking marijuana is a harmless plant. But the hemp seed themselves are safe and are free from mental side effects. Next question, is N-acetylcysteine the same as N-acetyl L-cysteine? And actually they are the same. In fact, N-acetylcysteine is also synonymous with a term called acetylcysteine. Sometimes they leave the N out, and acetylcysteine is also synonymous. Regarding N-acetylcysteine, is it optimal to use with a nebulizer or other medications? Now, it actually is used as a nebulizer in hospital settings when we have thick mucus. One of the advantages of N-acetylcysteine is it really thins out those thick mucus productions, and it can allow more oxygen into the cell, and it can actually involve more clearing of the debris from inflammation from the cell itself. And in fact, there's a trade name for that being used in the way it's prepared. It's called mucomist instead of, well, of course, it's N-acetylcysteine. That's the generic, but it's been made into a mucomist type preparation. But it actually, we would recommend it as a preventive orally. It doesn't require much. 600 milligrams twice a day is what the studies showed in that large randomized controlled trial that showed that if you came across the flu, 3 out of 4 chance, if you were taking that N-acetylcysteine, you had no symptoms. You developed antibodies, meaning your immune system fought it off. You never, in fact, it fought it off so readily, you didn't even come close to the cytokine storm, and didn't even realize that you had come across the flu. And the placebo group was far different. 8 out of 10 or more of those ended up developing pretty severe symptoms from the flu virus, and only 20% of them had an immune system that good that they didn't recognize that they had the flu. And so we're primarily recommending it in an oral state. Another question, zinc, how often should males take this supplement, and how much should females take? Well, I'm recommending that you try to get it from food, but there are certain conditions where we would recommend it in supplemental form. And this is something that we find out. There can be genetic predispositions of not being able to carry copper around well. We call it a metal metabolism disorder. So these are things we all measure from what we call the epigenetic analysis that we do in our program. And some people, their copper levels don't look high, but their free copper is very high because they don't have the genetic ability to handle copper. And those people are going to need higher doses of zinc. And male or female, they'll need higher doses of zinc. Females will often have this condition associated with hormonal depression, so postpartum depression or premenstrual dysphoric disorder often goes away once we balance the copper and the zinc out. And so, but we have to use zinc in a way that slowly increases it. I mentioned that zinc isn't very toxic at all. Any toxicity we get from zinc is essentially not from zinc toxicity, it's from too little copper, because zinc can drive down copper. But we have a lot more people that have excess copper than not enough copper. And so for people that have too much free copper, we have to build up the zinc slowly, because if their copper comes down too quickly, they can get anxiety from that. So we might start at 20 milligrams a day for a week, then go to 40 milligrams a day. And it really depends on their levels as to how much zinc we would end up recommending that they take. But it can have a tremendous difference as far as their mental health is concerned. So there's not a one-size-fits-all here. But for most people, if you want to take 20 of zinc, that's safe for virtually everybody. And so I wouldn't recommend necessarily much higher than that unless we knew what your other parameters were, and then we can build up as needed. Number 7, you said long-term mild chronic depression is worse. Does keeping chronic anxiety and depression under control with Zoloft or gabapentin help my immune system? Well, it can help the symptoms of depression, but Zoloft is not one of those drugs, and neither is gabapentin, that's actually going to gobble up free radicals. And so it can maybe help you cope with it better, so that your mental status isn't getting out of control. So I wouldn't say that it's something that you should stop per se, but I would really look at trying to get at the root of the cause. And maybe taking this new online program. You'll get a nice free test with that. You'll be able to determine what those underlying causes are, and then we can start reversing those causes. And once those causes are reversed, then there's a chance you can actually get off the medicine and still well control or have the depression and anxiety eradicated. But once again, it's not going to help your immune system boost like the things that we were mentioning earlier in the presentation. Next question, how can we counteract or reduce panic and anxiety attacks? Having increased numbers of these since COVID-19, so bad that I can hardly breathe sometimes. Okay, so what are some simple ways of being able to reduce those panic and anxiety attacks? One of the ways is the ways in which we're thinking about it. Let's recognize that the vast majority of people that we're going to meet in a supermarket or outside, they don't have an active COVID-19 infection. And your chance of even getting it in any supermarket, even in New York when you're going through, is less than 2%. We should still take all the precautions, but to actually freeze and get ourselves dysfunctional over a 2% chance of something is not necessarily rational. This is where the anxiety far supersedes the actual condition. So being acquainted and really reminding ourselves of reality can help. But another aspect of things that can help when we're out and about, there is a supplement that we do recommend for those that are having anxiety and panic attacks called Lavella. It's called Selexon 80. It's from lavender oil, and it's been tried against lorazepam, and it actually shows the same anxiety relieving properties, but without frontal lobe suppression, without dependency. And this could help take the edge off so you're not having the anxiety attacks. I would also recommend you load up on those antioxidants. You might want to take that zinc, 20 milligrams. You might want to take some NAC on top of that, get some good exercise, and then get that condition set up so you're on the normal sleep-wake cycle as you're getting melatonin. Melatonin can also help you with this. But certainly going through one of the approaches that we recommended, the home-based version, the community-based program, or the online version would be a great start. And if you are, on benzos or things like that, and you're still having issues, that's when you actually need a residential program. Or if you've tried some of these things and you're still out of control, this is where the residential program is designed for people just like you, and you might inquire about our residential program. So question, what are 3 specific takeaway things that I can begin to reduce stress this evening? Well, one of the things I'd recommend, let's go to bed early. Let's try to get melatonin start to be produced. let's actually write down some things that we're going to change in our diet. Can we get more of these antioxidant foods in our diet? And if you are having significant issues with stress and anxiety, look at those options of the home-based version or the online version, maybe the residential program, getting good, adequate exercise, adequate sunlight, and paying attention particularly to some of the major aspects, that lutein, zeaxanthin. See what we can do to develop recipes and foods that can have these healthy foods in them on a regular basis where we can take advantage of them. Would put you at a great, significant advantage as far as reducing stress and not having oxidative stress cause such a toll on your system. Well, I hope this webinar has been very helpful for you, and certainly stay tuned in regards to the material that we're coming out with, as you'll see some exciting new options emerge in regards to neuroimmunology and your overall health is concerned. And I certainly wish you all the health of body, mind, and soul. Have a good evening, and thank you very much.